When I started this journey, there wasn't a whole lot of information that I was aware of in terms of prostate cancer. It's not something that has been discussed within my family or within my friends group. So you get the impression that prostate cancer is something that you get when you're old. So it's not something that I ever had a discussion with my doctor about or any other men in my family. And since being diagnosed, I have since found out that I've had at least 2 uncles on my dad's side, both my uncles on my mom's side, my paternal grandfather, and there may be a few more out there, but those are the ones that I know about now that I have been diagnosed. That's something that would have been great to know in advance. That would have helped me to start getting screening earlier or talk to my doctor about it, because my doctors never started these discussions with me. But back in May, I had a routine follow-up appointment with my PCP. She mentioned taking what is called a PSA test to check my prostate. And PSA stands for prostate-specific antigen, which is a protein produced in the prostate and the urinary system. So I didn't think anything of it at the time. I thought I would just get the test and that'd be fine, but that would quickly change once I got the results back. So my total PSA came back at 7.4, and typically you want to be less than 4 for that particular measurement. Being over 4 doesn't mean that you have cancer. The increase could be caused by an infection or something to that effect. However, they pair that with a measurement of the amount of free PSA in your blood to refine that test a bit. So there are 2 types of PSA, one that is bound and one is unbound. The unbound is also known as free PSA. So the more unbound or free PSA that you have, the better it is for you. Generally, having 25% or more free PSA means that you have a benign condition, so that's probably prostatitis or some other kind of infection. If your free PSA is less than 10%, it indicates a higher probability that you do have cancer. The reference chart on my PSA test gave me a 50% chance that I did have cancer. This is because I had a total PSA that was between 4.1 and 10, and a percentage of free PSA that was between 0 and 10. So my primary care provider was suggesting that we retest in 6 months to see where things stood then. But because of the results, I wanted to get ahead of things. So my insurance allows me to self-refer, so I scheduled an appointment with a urologist to follow up on the results. I saw the urologist. She ordered 2 additional tests for me to determine if I should have a biopsy. One of the tests was another blood test, and the other was an MRI with contrast. The blood test is what is called an iso-PSA test. This is a test that was developed by the Cleveland Clinic to differentiate between high-grade prostate cancer and low-grade or benign prostate cancer. For this test, you are given an index score, and you want that to be less than or equal to 6. Mine was at 26.2. So along with that, my total PSA number climbed slightly to 7.55. Not a big change, but it did increase slightly. With an index greater than 10, that provides a positive predictive value of 64%. So the MRI was also done, and this showed that the size of my prostate was increased slightly. Typically, the size of the prostate is about 25 cc's, and mine increased to 30 cc's. It was given a dimension based off the MRI imaging of 3.4 by 4.3 by 4 centimeters. We'll come back to that in a moment. Additionally, the MRI showed a lesion that was about 7 millimeters in size and was given a categorization of PIRADS 4. So 5 is the highest categorization for this diagnosis, and a categorization of 4 means that there is a high likelihood that there is clinically significant cancer present. So with the prostate dimensions provided by the MRI and my total PSA number, there is a calculation that is done that is known as PSA density, which is supposed to be highly predictive of. So a PSA density of 0.2 or greater raises the concern that there is cancer that may need treatment. So mine calculated out to 0.25. So that put me above that threshold. So it increased the likelihood that cancer was actually present. So all signs were pointing to the fact that I did have cancer, but the only way to definitively diagnose prostate cancer is to do a biopsy. So a biopsy was ordered, and I got that done in September. The biopsy involves you taking antibiotics the day before, the day of, and the day after the biopsy. These are, for me at least, it was antibiotic pills. And for good measure, prior to starting the biopsy, they give you a shot in the butt of antibiotics just to ensure that there is no infection. So the procedure involves them using an ultrasound probe that is placed in your rectum, and then they start shooting biopsy needles through the probe through your rectal wall into the prostate. So they split the prostate into 12 sections and take a sample from each of the 12 sections. And just a heads up, because this was not made aware to me prior to having my biopsy, I was told while I was on the table that this would be the case. You're likely going to pee blood for the first few days. It may just be a little. And for weeks, you're going to have blood in your ejaculate, and it's going to change colors over time. It's going to start off being bright red, like fresh blood, and then it's going to turn brown before dissipating. So I was scheduled to come back and go over the pathology report within a few weeks. And based on all the previous tests, I was fully expecting to have a diagnosis of cancer. It was just a matter of how bad the cancer was going to be. But I can tell you it's still jarring to hear the diagnosis, even though that's what you're expecting. So I was given a Gleason score of 6 or 3+3. I won't go into the details of what that means, but essentially is grade 1 of cancer, which if you have prostate cancer, this is the grade that you want. This means that the cancer is low grade and the least aggressive form of the prostate cancer, which could normally make you a candidate for active surveillance. However, it isn't that simple though, because nothing ever is. While I have grade 1 cancer, my cancer is more than half on one side, known as clinical stage T2B, and my cancer is on both sides of my prostate, known as clinical stage T2C. Additionally, more than 50% of my biopsy cores came back malignant. I had 10 of my 12 biopsy samples come back as positive. So you can see here the only 2 sections that did not come back as positive are right here. Everywhere else came back as malignant. So these things make my cancer more likely to spread beyond my prostate and puts me on equal footing with someone that would be a grade 3 patient. So I am not a candidate for active surveillance. Actively surveilling may lead to the cancer spreading to my bones or other organs in my body. But additionally, I needed to take what's called a PSMA PET scan, which uses a prostate-specific radiation to determine if there is any cancer in the body that has escaped the prostate. So they inject the radiation intravenously. You have to wait an hour, and then they take the scan. So I took mine yesterday, and I'm waiting for the results, and I will follow up with the oncologist in a few weeks before deciding my final course of treatment. So that gets you up to date on my journey so far. I will keep you updated as I go. Hopefully this fills in some gaps for others that may be embarking on this journey or just wanting to research. There's a few things in here that I was unable to educate myself on via the internet, through Google or YouTube. So hopefully this helps someone out, and I'll keep you posted on where I am on my status in this journey. Thanks for checking in. I'll talk to you later.